how to set up the room and Artemis for a SpaceOAR or transperineal fiducial marker procedure when you're using the Artemis instead of the stepper. Typically, a stepper is used if you have one available. If you don't, you can use the Artemis to basically do the same function as the stepper. However, you have to do a little bit of setup to make the Artemis work for this procedure. So the first thing is, if you can picture, the patient will be lithotomy on the table, right where that phantom is. So their legs will be in stirrups, they'll be laying on their back. The ultrasound will be to the left side of the table, as usual. The Artemis will come in between the legs, so you want the dome of the Artemis between the patient's legs. And to make the work area a little bit easier, as opposed to having the Artemis in the typical starting position for transrectal at the 90-degree position, you want to try to condense the width of it so that it can fit between the legs a little bit easier. So to do that, you can just bring the cradle closer to the dome and really just try to line up that joint, the second joint, to this part of the arm. You can see that makes the profile a little bit more narrow, but you want to make sure that this part is level. You don't want to have this up or down. This has to be level. The probe has to stay level the whole time for the procedure. So you can just bring that in closer. And then another thing you can do is make the arm joints a little more straighter, as opposed to having them in that triangular 90-degree position. It's a little bit too wide. You can kind of manipulate the arm to get it a little straighter, and again, have the dome come in between the patient's legs. So sometimes you have to ask the staff in the room to bring the patient's left leg up and out more if they can, and that way you can fit the dome in. And it's going to be a tight fit on most patients. You'll see that the stirrup usually touches this side of the dome. That's okay. And sometimes the patients can't raise their hips a lot if they have a hip replacement, so you just do what you can to kind of finagle the Artemis in between the patient's legs. So for using the Artemis, you want to obviously not use this cradle insert. You're going to want to use the longer one, the longer white one. This system doesn't have that one, but I'm just going to pretend that I do have it. So you're going to take this out. You want to take this top latch off. So to do that, you're going to use this pin here. Just turn it, pull it out. You can see once you turn it, that little notch comes out, and then you can pull the pin out, take off that cradle top latch. And then you're going to use the TP NGA cradle instead. But we're going to change something first. We're not going to use this whole piece. This part here, with the knob and the needle guide, is for TP biopsy. So that's when you're doing a TP fusion biopsy. The needle guide will snap on here, and the doctor will be going through the needle guide, and this is how they target anterior and posterior. If you can picture, they're angling up and down to get anterior, posterior on the patient. So we don't need that, and it's going to be too difficult, for them to get the needle, because remember, they're freehanding the needle for these procedures. They're not going to use a needle guide because they need the needle to be able to go this way and this way in the perineum, so that if you're using a needle guide, it prevents that kind of movement. So to take this off, there's little screws here and here. Sometimes there's one here on some of the systems. This one only has one. So it's like a spring screw. So as soon as you loosen it, it'll pop out. And then this part just slides right off. So the part with the needle guide, we don't need. So the part with the wire, that's the encoder, we don't need any of that. So we're going to put that aside, and we're just going to use the top latch. So we're going to use the same pin. It's going to go right through these holes, and we're going to put this on the cradle now instead of the other one. So you can see I use the same pin, go through the holes till it's coming all the way through. That little notch here is what holds the latch in place. So you want to make sure the notch is going on this side of the lid. And I'll show you how it goes in. It just turns right into that slot on the back of the latch. That's what holds it in. So now this is the cradle. You're going to use the long cradle insert. This is the regular one. So there's one that's a little bit longer. That's the one that goes with the biplane probes. This is the regular one for the C41V. So this is why the probe doesn't really fit. You can see it's a little bit too long. It doesn't seat good, so there's a longer one that we're going to use. And then, you know, same way, this is going to clamp down and lock it in place. So when you're using the Artemis, you're going to set it up this way so the probe is seated into the cradle and latch it. Typically, the doctor will freehand insert the probe first and then hold it, you know, at the midline level, and then you'll come in the same way as you do for the biopsies that we do normally, and just dock the probe into the cradle and lock it in place. And then you can do the fine adjustments using the arm, you know, to center midline. So you're going to move the arm left and right using the arm lock to center midline, and then you can bring the arm in and out to be around the mid-gland area. And then for doing the stepping in and stepping out, you're going to use the linear lock to go in and out. So when the doctor says step in, you're going to go in. When the doctor says step out, you're going to come out. Sometimes on a big gland, you may have to use this arm lock to come in and out because this doesn't go far enough. So just be careful though that when you use this, you're trying to keep the probe from moving left and right. You want it to come in and out linear as best as possible. It's okay if it moves left to right a little bit. You can just fix it if it does. But usually the doctor will want to see from the base seminal vesicles all the way to the apex while they're doing the fiducial marker and SpaceOAR injection. To go left and right, you're going to use the rotational lock left and right, just like we used during the biopsy. But you know, for here, because the patient's in lithotomy, it's going left and right. Whereas for the C41V, the rotational lock, as you know, goes from transverse to sagittal. So remember, we're pointing the crystal where we want to see. So when the doctor says go left side of the patient, you're going to turn the probe to the right because it's reversed. You know, the patient's left is over here, the right's over here. So you're just turning it toward the side that the doctor wants to see. So the only locks we're using for this is the rotational lock, the linear lock, sometimes the arm lock to come in and out if you can't get enough with the linear lock. You never use the tracker arm to do anything with these procedures. This stays fixed in this position. And this is the conclusion of setting up the Artemis for SpaceOAR.